Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo in the studio. A beautiful looking day out here, and it's so nice. We've covered so many things that are disastrous and earth shattering, and we talk about a lot of things. It's nice to have a beautiful day out here for a change. That's pretty cool.
It is cool.
There is, however, in the midst of a beautiful day like we have, any individual can experience something that just kind of changes everything for them. And that's what struck me about the topic of today's Health Matters, who is a person that we both know, and they're near and dear to us, and a health crisis that began for him when he was just an ordinary day like this, standing at a counter in a store, and all of a sudden lost sight in his eye, and then began this huge thing that we're going to talk about a little bit about what happened with him medically, but then also what he had to go through to get the attention he needed subsequently.
And it's specific to Del Norte County, what he did right, and what the system did wrong, and what kind of changes might be helpful specifically in this area. Okay.
So. And as far as setting the stage for this, I mean, the person we're talking about is very much in that Del Norte sort of boat. You know,
totally.
No primary care physician, no health insurance, no health care. I mean, just basically going through his life until something happens to him.
I do think he has Medicare because he's an older gentleman, and he does have a primary care provider. But it's not the clinic. It's not the big clinic system.
And that primary care provider, though, was subsequent to his crisis. I don't think he had one initially.
Really? He told me he did before, but that's a minor point, really.
Yeah.
So he's sitting in the store, all of a sudden loses vision in one of his eyes. Kind of does the usual Del Norte thing. I'll just watch it. It'll get better. I don't want to go to the ER. Goes to the ER. Finally, it's... kind of figured out that he had some kind of neurological event, probably a stroke. Turns out to be long-term. I mean, his vision is gone. It's not like it was reversible. Probably from long-standing hypertension, although he was taking medicine for it, so he was trying to do his part. And this is what he did right at this point. So it was decided that he needed what's called a carotid endarterectomy, which is just a roto-rooter of his carotid arteries. So not a hugely complex surgery, not a go out of the area to UCSF kind of surgery, but not, it's one that's got significant risk for further stroke. And then plus they're making an incision in your carotid artery, in his case on the right side. And it's not like you can drive yourself back. His surgery was in St. Joe's. Not like you could drive yourself back. And so he immediately had a transportation issue.
Right. So this is something that care-wise that anybody listening
we all get that. Yeah.
We all hear, but anybody listening not in the area doesn't understand that the closest care for him was 80 miles away.
Right. So, in kind of a complex situation, he has a lot of dogs, he has a lot of chickens, and he is a ruggedly independent, prideful, in the best way possible, Del Norter.
Yeah.
And so I don't think it ever occurred to him to really ask for help from his friends.
I think he just kind of assumed he'd drive himself.
Yeah.
That was like the first plan A, and then had to resort to plan B when that's untenable.
So here's what he did right. So, his primary was kind of backed up, so he was able to directly access contact with a receptive vascular surgeon. And so this vascular surgeon is Dr. Michael Palmer, who, with his trusty PA, Katie Schoenfeld, they actually come up here and they see people every Friday out of Blundell's office. And this is like a miracle.
Wow.
And I know I've talked directly a handful of times to Dr. Palmer and a lot to Katie because, we're PAs and we're connected. We're also mothers, and our kids went to the same school. So I have her direct phone number. So, and he was receptive at, taking the work up further and then also surgically treating Ralph. And I think Ralph, and he can tell me if I'm wrong, contacted him directly.
Okay.
So not only was a specialist, had the skills, is in the community on a regular basis and was receptive to a direct Medicare referral. So Medicare, supposedly they can self-refer. So a little backstory on that. So when people have insurance, most insurance companies use the primary care provider as the gatekeeper model. And so that means to get anything done, you have to go to your primary, and then your primary decides if you really need it done. But and that takes weeks, let me just say, especially in this community. But this was obvious. And for some reason, he's had some outside of medicine contact with Palmer before, and he was able just to show up at Blundell's office and make an appearance.
So this surgeon he needed was just some guy he already knew in the community.
Yeah, in some way. I don't know if I think it's outside the medical arena.
Right.
But, and the other thing is Dr. Palmer, bless his soul, is a receptive doctor to people just showing up. And if he thinks he can help them, he's all about it.
That's wonderful.
And if you say, oh, he doesn't have insurance, he's like, why are you even telling me that? I don't care.
Right.
I think I can help him.
And that's so the person we're talking about, that's so him. It's just some guy he knew outside of it.
Yeah.
So that's fantastic.
He Del Norted that.
He Del Norted
very
it.
nicely. And then the other cool thing is not only is this practice duo up here every Friday, that means they drive through the winter and the snow and the stuff.
And they don't have to be, right? He's not like contractually obligated to be here and provide care.
Yeah,
right?
he's a super busy surgeon, and I don't think he needs the money or anything, but he understands the need. So I have personally sent like acutely psychotic people with a vascular surgery need over to him that had no insurance, and he's like, send him over.
That's amazing.
And I should say this was at 7:30 p.m. at night.
Oh my gosh!
In the winter when he had to drive back. But so super willing to help people with what he can help them with, no matter what their situation is. So, and they tend to see a lot of people. They cram them in there. So, the next thing Ralph did right is he did use patient services to try and secure a ride to and from Eureka. Okay. For the surgery. And there was some question at the time whether patient services, now let's review, they're in the Del Norte Community Health Center, aka Wellness Center. And when you go in the front door, if you go to the left, there's patient services. If you go to the right, there's receptionists ready to sign you in for your appointment. So going to the left, he accessed patient services to try and get a ride. Now, and we verified there was a little bit of a sticking point here because he's not a patient at Del Norte Community Health Center, and so a new employee was a little confused by that, but it got clarified. And she tried to find him a ride. They do need 2 days of lead time, and I don't think he met that criteria. And they also gave him a pile of paperwork, which a lot of Del Norters, they just don't do paper. So those were a little bit of hang-ups, but they persevered, and they were able to get him a ride. Now, the ride initially was a little weird. They contracted with Shasta Taxi. Does that imply that that's from Shasta County?
From what I know about other folks who have to take these sorts of services through different, or set up. I know a person who has to go to basically it's like Medi-Cal dental appointments in Redding.
Yeah.
And it's like a taxi company that very well could be Shasta Taxi that comes up, picks him up, drives him there. It's an all-day thing for everybody involved, but they physically drive one person to Redding. That's how they're dealing with it. But yeah, I think that an assumption that it is a Shasta Taxi company would be.
Well, I don't know if it was Shasta Taxi, but his first attempt to get there when his surgery was initially scheduled failed because the taxi service, whatever they are, didn't show up. And I had the sense they were from way out of the area.
Could it be? I don't know. I don't know if it was the same because subsequently this whole thing worked for him, and I was part of that working thing, and it was Eureka Taxi. That was the name of the company that it was dealing with. The first taxi company, that first attempt, explained to him that they had told patient services that they didn't get enough lead time to get him into the schedule and to get him on. It was inside that 2-day window. They the taxi, whether this is true or not, but this is the kind of thing a patient is kind of stuck having to figure out for themselves. The taxi person said on the phone that they had told patient services they could not do that. They could not give him a ride, but patient services hadn't contacted him, or at least he missed the attempt at contact. He hadn't gotten that word from patient services that the ride was going to happen.
So he was already at
6 a.m.
Yeah, nobody showed.
Yeah.
Now, so there are a number of barriers to care in there. Having a taxi company coming from way out of the area is a barrier. The 2-day thing in medicine. So, disease doesn't take a day off, and neither do we. And so I don't know that somebody outside of the medical world would get that necessarily. So a taxi driver, they might have a lot of other things playing into whether they can be available.
I see what you're saying. Yeah. And the particulars of that particular ride might not be foremost in there.
Right. Yeah. So this whole transportation system, people that need to get out of county care is super wobbly. Mm-hmm. And then UHS, though, has a few vans and then drivers that deliver patients directly, which I think is cool. So couldn't that happen here? That would get rid of that barrier to care, maybe.
So does that service for UIHS patients in Del Norte exist? Mm-hmm. What's that like? What's the what?
It works well. It's usually for elders. They're
okay.
I think they drive individuals, but I think of at least within the county. But if they're going out of the county, they do take a couple of people in a van ride down. So I'm wondering if something like that could happen. But here's what I'm going to hear from the drivers is we don't want to drive people that might be medically unstable. What if we're in the middle of the bypass and somebody has a problem?
Well, so how do they deal with that with the UIHS drivers?
They don't have that fear.
Why?
I don't know. Maybe they're more committed to their tribal elders or something,
sure.
a higher level of commitment. Mm-hmm. I don't know.
Interesting.
But they never talk about it as a thing. Mm-hmm. Mm-hmm. Although I would not be surprised if it came up in this conversation. Mm-hmm. But this is a huge barrier to care.
Yeah.
It was a problem for our friend. And then I also think it's super important that sick people trying to organize care for this kind of stuff, that there be a closed loop of communication between them and the person that's trying to get them the service.
Okay.
So here's a problem that happened with patient services. So, and I think this might be generational, and I'm probably setting myself up for a target, but there was a sick elder individual is going to want some kind of callback at the end of the day with an update on how their need is being filled, even if the call is saying, nothing happened today to progress toward what you need. This is what we're going to try tomorrow.
I see what you're saying. Generationally, and it is a generational thing that right. you have to interact just on a different timeline with different stress points with somebody who might be expecting it who's older.
Older people fret.
Yes.
And this individual has already given up eyesight in one of his eyes, which is impacting his ability to walk, okay, and to remain independent. So I think a callback from, I'll say an organizational helper, like a MA, or I think this is a social worker in this case. Even if you're saying no progress was made, nothing has changed, this is what we're going to do tomorrow, it would be super helpful.
I think I agree with that entirely. That would be so, just to have somebody who could take you all the way through the process. And from my experience of this whole thing, because I was standing and helping and talking on the phone and doing things with all of this, was that there was a system in place. But there wasn't a human that went through all the motions, all the parts of that system. And
it was too fractionated.
Yes. People had too much, well, I did my part and the system is there, so I can go home and not worry about anything.
Exactly.
Yeah.
Exactly. And I don't think this represents that they're not caring. I just think that the system is too fractionated.
Yeah.
So, but I do also know being on the other end of the phone call sometimes, that when you call and you tell somebody that this really important thing, there's no progress been made, then they start yelling.
Yeah.
Okay, this is not cool. And then people don't want to call you back.
Sure. You have to have a very specific kind of person who's willing to make that call.
Yeah, they don't want to be yelled at.
Yeah.
So everybody needs to just, people need to follow through, and people need to be appreciative of the follow through, even if it's not what they want to hear.
Yeah, exactly.
Right.
You know what's going on. Yeah.
Yeah.
Or not going on in this case.
Yeah. And then as part of that, there needs to be more reliable phone numbers where you can actually reach a human to help with a particular problem. So one of the attractions that administrators were kind of advertised to in getting computer systems in medicine was that they could cut the number of staff. And so I myself recently had an ultrasound done at Sutter Coast. And the first thing I was instructed to do was walk toward radiology and sign in. And so just standing there being ignored for 20 minutes.
At radiology?
That was super interesting. I wasn't angry. I found it interesting. So I counted the number of desks that are in the radiology office that are used for regular office people. There were 9 desks. There was only one person sitting there who had her back to me and was totally ignoring me. I mean, I was like coughing and fidgeting and so
you're looking through that window there. Is that where you are at the
window
door?
was open.
I know what you're talking about. Yeah.
Yeah. And so
did you say anything?
No, because I just wanted to see how the process would unfold for Joe Average.
Okay.
She was really nice once she was ready to help me. But so you have fewer people doing more work with tools that don't always work.
Yeah.
Okay. And then I noticed when my mom is ill and passed away recently, is that we were getting phone calls from ER doctors to talk about important topics, but they were calling from, their calls were being rerouted through a totally different department at Kaiser and a more general number. So when we were calling that number back,
you wouldn't get back to the person. Oh.
We were instead of talking to the ER, we were talking to on-call psychiatry, which is not relevant.
Yeah.
So those kind of things, people really do need to communicate, and cutting down the number of calls, because you're cutting down the number of people that can answer the phone, or you're rewriting the numbers and keeping, the real numbers hidden. Like, what is that going to do but make people yell?
Right. And on one hand, if you're looking at it in one context, you go, oh, this is so efficient. And if you're looking at it on the other context, trying to use it, you go, this is so inefficient.
It's completely inefficient. And it kind of a part of that too is currently you can't access radiological care, probably blood draws too, without having orders going through the computer system. And it doesn't matter whether you have printed orders in your hand or not. It has to go through the computer system. That is not instantaneous. That sometimes never happens. The amount of important orders, for important medical things orbiting Pluto is immense. Okay. And so those poor people, that one person who was in the office that had 9 desks, so at one time have a lot more people, is trying to do more work with a less efficient tool. And there should still be some backup thing. Well, if it doesn't work this way, then we could do it this way.
Right.
Yeah. And if you really want it to have it computers, then have that be your solution, but have it be a workable solution.
Yeah, exactly.
And it's not like I just found the one case where it didn't work and and they really only have less than 1% error. I would say it's more like 50-50. 50% chance that it'll work.
From your experience, the kind of, when you talk about orders and orders in the computer that maybe never make it to the computer or never make it where they're supposed to go, how many times do you have to ask for clarification on orders? Like, how many times do you have to ask for, I don't have your order here, have it resent, I don't have something?
50-50.
Really? Half the time? Wow.
And it's possible that the order will land in 2 weeks. But if your baby has pneumonia, and you're making a decision right there in real time whether that baby needs antibiotics or some other treatment, that's not good enough.
Man, wow.
So, yeah. It's horrible. And when you try and get things done at other hospitals where maybe the interface is not as regular as we have here with Sutter, say Medford or something, it's worse. Wow. It's awful. So, and here people are anxious about something that's super important to them. It looks like people don't care. And then they start yelling, and then people don't want to be workers don't want to be yelled at because there's nothing they can do to fix the system. So barriers to care everywhere.
Yeah.
So this is we're just sticking our toe into the pool of barriers to care.
What was now subsequently with the person we're talking about here? It took a couple of weeks, but he got his surgery rescheduled. He couldn't make that, the morning of, couldn't figure out a way down there. The day that the system, quote unquote, did work, it was so haphazard and by the seat of the pants, and nobody had any idea what was going on.
Super confusing.
Right down to, and I know this has nothing to do with what we're talking about, but I was calling the taxi service to find out if for this person, I was calling the taxi service to find out, is this even happening today?
Right.
Should we be looking around for plan B right now because it's 5:30 in the morning? Is the taxi coming? The person I'm talking to isn't even in Humboldt. They're someplace else at a call center, working for this. They're explaining, I'm sorry, I'm not there. I will message and call and see if we can find out. And it took a while, and then and it was working, but that wasn't even not readily. That wasn't visible at all to anybody. Even you had to really dig to find out, is this going to happen today, or else just stand there quietly and see if you miss your surgery for the second time. It was very confusing and very slapdash, it felt like.
Right. And so even though he has lost the sight in his right eye, I think it's his right one, his surgery was a success. And it was a success because his surgeon was available.
Right.
He had those, and he Del Norted it and, worked the system. The paper caught up with him later, I think. And then he just persevered, I think. I think he did start yelling, but I would have started yelling a lot earlier, actually. So it was super frustrating for him, but his surgery, he's healing nicely, doing really well. But this shouldn't have been this hard.
Right.
And so this kind of shout out to the community, I guess, especially all those people who are kind of greeting, patients at the window and stuff like that. Feedback loops are super important, or people making telephone calls. Feedback loops are super important, and people who are anxious about their health are going to get even more anxious if it looks like they're not being heard or they're not being paid attention to.
Yeah.
And it's super easy to say, well, I only do this one part of it, so I don't know about the rest of it. Maybe the next sentence is, and let me see how I can find out for you.
Right.
Just that sentence. And then also, I'm kind of wondering why a partnership in Del Norte County doesn't have an actual van service, or maybe some kind of contract with the bus service, because the bus service goes down
every day.
Yeah, they go down and back all the time. Is there something that can be done kind of on that level? Because it's not like we're in San Francisco and he could just take the next bus or something.
Right.
But even then, you couldn't take a bus coming home from surgery like that.
Unless I'm not sure. I know that my son worked at it wasn't in an assisted living facility in San Francisco, but it was kind of like it was like daycare for old people. It was a place for them to go all day, and it was they had a fleet of vans to take people anywhere they needed to go, all over the place. And I understand this might have been a higher end sort of service offered to elderly people in San Francisco, but it's not impossible. And even in a place like where you identify the need and have the resources to address that need, like San Francisco.
How about if you flip it around and you're a young entrepreneur and you could see yourself doing that, or providing that service? Approach patient services, maybe a contract between partners. I find it hard to believe that in all of California, there isn't another county that has some model like this. I think the model exists.
Do we assume that the model is contracting with private businesses like taxi services? So Humboldt's doing it, or St. Joe's is doing it.
Right, but I think more specifically for medical, medical appointments, it's not necessarily going to the casino and back. You know?
No. And I think that's exactly what the taxi service in Humboldt that was coming for the person we know. That's exactly what they were doing, was for that. It was for medical things. Just like the other person I know who has to go to the dentist in Reading, which seems ridiculous. That also is with a private company.
Yeah, but it seems weird to have them based in Humboldt to come up here to pick somebody up to go back to Humboldt. Yeah. So could somebody up here do it?
No. And I'm sorry, and I'm sort of disappointed that we have to fall back on, some entrepreneur can do this, when the system really should be handling this much better than it is.
Yeah. Yeah, but anyway, I was going to say maybe they can do a study. I don't think they need to do a study.
No.
I think they know there's a problem.
Yeah.
And then what do you do when Mother Nature slaps a fire on top of one of the main routes or Medford? It gets more complicated. Can't really do anything about that, but I think the model exists in another county in California, and I think it needs to be. Now's the time.
It sounds like the model exists with UIHS.
Yeah, there you go. They do really well. They have I think 3 or 4 drivers. Super nice people. All of them women. Just coincidentally,
that's really weird.
Kind of the anti-role.
Yeah.
So they're really good at cultivating relationships with the elders and keeping them from getting anxious.
That's really cool.
They call them. They know where they live.
They're that human. They're the human that's above the system.
Humanist, and then they work together well, and they don't fractionate, and they don't ever say, "Hey, it's not my job, man."
Right.
And
it's important to treat patients like humans. When our patient, we'll call him Patient X, when he returned after he's down for a day, went down Friday, comes back late Saturday afternoon from his surgery.
And let's be clear, he was an inpatient at St. Joe's.
For
that night.
For that night, he was there. Yeah, he wasn't wandering the streets.
Right.
Came back, he had stitches on the side of his neck, and just wow. But they pull up in a taxi, and they pull right into the driveway, and. And he gets out and he's talking like full bore to the young driver. And he gets the young driver out who doesn't live here, is probably going, I'd like to get home and I got to drive all the way. Right. Gets him all the way back and sends him back to the greenhouse because he's been talking about the tomatoes he grows. and he can send the kid home with a handful of produce.
Now, see, the women who drive for UHS would be like so into
They would be all over, yeah.
And how's the baby? And,
Humans, man.
Yeah,
humans.
Totally. So, but this is one striking barrier to care that I thought deserved to be commented on. I mean, we could talk about systems analysis and how they're rebranding critical access on a national level, and is healthcare a right or a privilege? But this right here with our friend was a deal, and his community helped him, but not everybody is so lucky.
Right.
Nor did it come together completely smoothly.
Yeah. You can't Del Norte it all over the place if you don't. Right. You don't live in a place like Del Norte.
And shout out to Michael Palmer and Katie Schoenfeld, because thank you for what you do for our community. It is way above and beyond.
Yeah.
And I appreciate the care immensely.
And again, and I keep falling back, this seems to be the takeaway for me from this episode, this show today, is that it's the human touch. The human touch that's missing when our systems fail and fall apart and let people fall through the cracks. And when they succeed, it seems to be because of that human touch, like Dr. Palmer, who comes up here and he doesn't have to, but he comes up here because he's a doctor and a conscientious person. I think that's amazing. And
thanks to the doctor who gives him the office space too. That's nice.
Yep. All
Blundell.
right. Dr. Blundell, yes, indeed. Well, that's just about it for this week. Have you thought at all about next week?
Well, Dr. Terry Raymer, who works at UHS, wants to come and talk to us about immunizations coming up. I thought you could use a different voice for that.
Oh, and 'tis the season.
There are some new things. He's going to be focused on the flu shots. And then he wants to come back also and talk about preventing diabetes, because he's a diabetes specialist.
Oh, wow. Okay.
And so we got those 2 shows coming up.
Excellent. All right. Well, keep an ear out for that. And we'll talk next week on the next Health Matters. Thanks, Lynn.